Hi, I'm Bobby Peer with TAPinto, and I'm here with Dr. Anthony Terrana from Terrana Orthodontics. Welcome, Dr. Terrana.
Thanks for having me again, Bobby. Pleasure as always.
I love this. So we're going to change it up a little bit today
hmm
because we typically pick a topic about orthodontics and we drill that home, not literally. So I really want to do an interview where we get to know you and ask questions about like how do we as parents do our research and what should parents look for when they're searching for an orthodontist?
Yeah, I think that's actually a really great question. There are a lot of orthodontists out there, and we're all great orthodontists. But there's certain things if I were looking for an orthodontist, I would want to see. Number one, probably, are they available? What's their availability? Are they only in a couple days a week, or are they there full time? Right? There's always going to be orthodontic emergencies, orthodontic concerns. You're going to have questions. It's always great to know. In case our office, we have appointments Mondays, Tuesdays, Wednesdays, Thursdays, Fridays, and Saturdays. So we're pretty much always available to parents. If a parent has a question, they have an emergency, they can either call us, text us, email us. I've responded to parents as late as midnight, if I'm awake at that time, just to ease people's minds and make sure, their child's taken care of. Um, Another thing, you want to make sure they're up to date with technology. There's so much technology coming out, and this technology is there to help patients, right? To have a better overall experience, to have a more accurate treatment outcome. So you want to make sure, do they have a digital scanner to take impressions of teeth? We shouldn't be doing those gooey impressions anymore. Do they do computer aided braces placement, right? Do we place the braces on a computer, like at the outcome simulation, to make sure the teeth are going to be straight? Or are they hand placing them still the conventional way, right? That's not as accurate. That leads to more treatment time. Do they use self-ligating braces? That allows parents to bring their child in every 8 to 12 weeks for an adjustment versus the old school way of doing rubber bands around each tooth, which leads to 4 to 6 week adjustments. That's almost doubling the amount of office visits they have to have. And nowadays people are really busy, so they don't have time to constantly come to the orthodontist every 4 weeks. Kids have sports, they have school. There's a lot going on. You want to make sure the orthodontist has good bedside manner, that they're describing what they're doing at each visit. They're open to questions. I have my parents come to the back, they sit with us. We're showing them exactly what's being done. We tell them what's going to be done next time. So to me, that's really important to make sure that they're aware of what's happening in their mouth, that the child's aware of what's happening in their mouth. Those are all really important things. I would say those are the major things. Another thing, that we offer is a lifetime smile warranty. So a lot of times, maybe a child goes away to college, they lost a retainer, their teeth shifted. Are you going to now want to pay a full case fee to be retreated? Or is it nice to know, hey, you're under warranty. I'm going to be here for the next 30 years at least. I have a long time to go. So as long as I'm around, we'll retreat and take care of you. So those are all
Great
really
to
important
know.
things that I
Oh,
believe
wow.
we
Um,
should
I think
offer.
that's really important. So,
hmm
um, I would love to know, how did you get into orthodontics?
Yes, that's a great question. So, when I was young, I was afraid of doctors. I hated going to the doctor's office. And the one doctor I actually enjoyed going to was my orthodontist, right? I had a really, really big gap between my two front teeth. I never smiled. I hated the way I looked. Couldn't, just didn't like it. And my parents took me to an orthodontist. They closed my gap. Like it just skyrocketed my confidence. And every time I went there, it was always just a fun atmosphere. I knew I was safe. I wasn't going to get poked with needles. There was nothing that was going to hurt me there. The assistants interacted with me. The doctor interacted with me. So it was such a great experience that I was like, this is what I want to do one day. And I stuck to it. And luckily, I'm honored to have become one.
Now, going to college,
Mhm.
when did you know that you chose the right career path?
Yes. So, in college, we do a little bit of, well, not much when it comes to dental, but really when I got to dental school and I shadowed all the different specialties, endodontics, pediatric dentistry, oral surgery, orthodontics. And every time I just went to ortho, everyone there was so happy. You were dealing with healthy people.
Mhm.
it was life changing for people. Like just showing them before and after photos, and it was just a great environment. And I think it's just a wonderful service to provide people, and just see people's reaction when they're done with treatment, like how excited they are about how nice their teeth look. It's
It's
very
always a good
rewarding.
outcome, right?
It's yeah, always, always.
So, what do you feel is the most rewarding part of being an
The
orthodontist?
most rewarding part is definitely just when we're done with treatment, just seeing everyone's reaction to like, hey, this is what your teeth look like. This is what they look like now, and it's completely life changing. It's just an amazing feeling to know you're actually helping people. Every day I go to work, I'm helping someone. I'm making someone more confident in their smile. It's amazing, and
You're
it's a
creating
happy
smiles.
atmosphere. It's
Yeah.
happy, you know.
Now, and we've touched upon this, but how do you
Mhm.
stay current in technology? I mean, we've
That's great.
talked
And there's a
so
lot of
much.
technology.
Yeah.
It's going to conferences, right? There's a lot of continuing education. It's staying up to date. It's reading the newest publications coming out. It's reading journals. It's going to all the newest. Every year, the AAO has a major conference and they introduce new technology. And it's not being afraid to implement that new technology. I know sometimes you want to get stuck in your ways. You've been doing something the same way for many, many years. And maybe that was great 30 years ago, but as we advance, we have to stay up to date with what is coming out in order to provide our patients with the best possible technology, the best possible service.
And it seems like you are always there. You
Thank you.
wear your high tech. So if you could give a piece of advice to
Mhm.
someone that is looking to go into the
Yes.
orthodontic field, what would that advice be?
Well, I want to say it's a great profession. It's not easy. You know, it takes a lot of hard work and dedication. But shadow orthodontist, ask a lot of questions, work hard. You'll get there. It gets great once you become one, and enjoy the journey. Enjoy the journey and just stick to it. And don't let anyone tell you you can't do it.
That's awesome advice.
Hmm.
So, this is going back to process. What
Yes.
is your favorite part of being an orthodontist? Is it
Hmm.
the diagnosis, figuring out the process, the treatment,
Hmm.
or the
Truthfully,
results?
I like it all. I like the diagnosis because it's a puzzle and you have to figure out how am I going to get all these pieces to the puzzle in the correct position to make them look best. It's the process of getting there. It's making the adjustments every time they come in, seeing the progress that we're accomplishing. I'm encouraging people to stick to it. And definitely at the end, when we take the braces off, that's an amazing day. It's a celebration that day for your brand new smile. They really see it for the first time without braces on or without Invisalign on. You just see like that confidence when they leave and how excited they are. So, the whole process is amazing.
Well, this was great digging into what
Mhm.
makes you happy, and
Yes,
you're making your patients happy. So thank you for another great
of
interview.
course, Bobby. Anytime. Thanks for having me again.